special edition of the Zero Hour. In this hour, we will be talking about the obvious news of the day, this pandemic, this global crisis we now face. And here to talk with us about it is my very good friend, Dr. MarkAlain Dery. MarkAlain is an infectious diseases doctor with a deep understanding of epidemiology, public health, the spread of disease in general. That makes him kind of the person of the hour right about now. So we appreciate his time, and we also appreciate the fact that you should know about MarkAlain, that he is especially interested in the negative impacts of poverty and inequality on health, which is a very, very, very important subject right now that is, in my view, not getting enough attention, and that he is the founder of 102.3 FM in New Orleans, our affiliate in the great city of New Orleans. That's WHIV FM, dedicated to human rights and social justice. I've said enough, Dr. MarkAlain Dery. Thank you for coming back on the program.
Thank you so much, RJ. I appreciate it.
So let's start with this. We were talking a little bit before we began recording about the kind of lockdown plans you guys are going into as a radio station, sheltering in place and all of that, which we are doing as well at We Act Radio. And in addition, I'm having to isolate myself. So I guess my first question for you is, how is this affecting you as a physician in your day-to-day life right now?
Thank you, RJ. I appreciate it. My life has been, as you could well imagine, very, very, very busy. And I've suspended all other activities, research. I was, in the process of writing a book. I know I shared with you on our personal conversations on the history of race, misogyny, of racism, misogyny, and trans and homophobia in medicine. And all that has come to a halt. All my HIV work and Hep C work has been slightly pushed aside, and I see anywhere between 40 to 50 to 60 people a day who are we are evaluating for the coronavirus, COVID-19. I've been abbreviating it C19. So if you hear me say C19, I use that as a kind of an abbreviation for COVID, the COVID virus 19. And we've been doing it through telehealth. And so one of the nice, if we can say nice things that are going to come out of this, is the amazing opportunity to do telehealth. And because what it has done, one is it allows me to see far more patients faster, and so the visits are 7 to 10 minutes long, and they're very focused around the symptoms associated with C19. But the other thing that's really fascinating is that I'm able to kind of video conference with people directly into their homes. And at really, quite frankly, at some points at some of their worst. I'd never realized. 20 years I've been in practice, and it never really occurred to me that people, even when they're sick, do sort of get dressed up when they go to the doctor, right? They brush their hair, they may wear makeup, they're going to get out of their pajamas and put on some clothes, and they kind of fix themselves a little bit to come to the office. But when I'm able to come to them through this amazing technology of video conferencing, I'm able to see them at and it adds a level of context as a clinician as they're showing themselves on their phone, and they're I can kind of see all around them, and it just gives me more kind of clues, and it helps me understand that process a little bit more. But yeah, it's been very busy. Interviews. Helping the city respond to things, and so being pulled in a couple different directions, and it's fine. I mean, this is, I've done this before. I know we've talked about this, the Ebola epidemic and Lassa virus and Hanta, multiple epidemics I've done and multiple disasters I've been to. So this is just kind of par for the course, but I do appreciate the question. Thank you so much.
Yeah, I mean, I think one of the things, first of all, that gets overlooked is that, the people who are on the front lines of all of this are giving a lot. And they're also, I mean, I know a lot of it's telehealth in your case, but they're also at risk, and not just at risk for C19 coronavirus, but at risk for burnout, at risk for all sorts of consequences of this pandemic. Now, you've been to, if I recall correctly, a number of hotspots around the world for deadly epidemics. I think you were in Africa. I think you've been perhaps Asia, other places as well. And did it ever occur to you that your hometown might be one of the hotspots someday?
It never. If of course, I'm a student of infectious diseases history, and so I do recognize, and of course, the most recent pandemic that we had seen was, of course, the Great Influenza of 1918, and so I do, let's put it this way: had I ever really thought about it? No. Would I have been surprised by it? No. I mean, I know that that's the way these things work. When H5N1 and when H1N1 were coming around, that's when you started to hear experts say we're overdue an epidemic, because these things cycle pretty regularly. And if you were to ask me to make a guess of what that epidemic would have been, I probably would have guessed a novel coronavirus, because this is the way these sorts of viruses kind of work. The influenza viruses, the ones at least that we saw, the H5N1, and of course historically with the H1N1, tend to have a lot of mortality associated with it. And oftentimes with that mortality, when you have a virus that has high levels of mortality like that, oftentimes they tend to be less infectious. This coronavirus, it kind of hits that sweet spot in that it has obviously a respectable mortality level that we've seen, which of course is what's driving the fear and the anxiety, well-deserved and understandable fear that people are experiencing, and the well-deserved and understandable anxiety that people are feeling. But it doesn't have that same level of virulence that some of the other pandemic or some of the other viruses that we've seen in the past recently, that H5N1 in particular, or even SARS. SARS had a much higher, I think, a 10% virulence rate. So when I say this one hits that kind of sweet spot, it has just enough infectivity so that it circulates through a community pretty easily, without necessarily killing the host as rapidly as some of the other viruses have done, which would make it less likely to become an epidemic. Did that make sense, RJ? It made sense to me as I was saying it.
Yeah, no, I understand. But just to clarify, so what you're basically saying is, of course, it's a sweet spot for epidemic, not a sweet spot for humanity. And so what you're saying is it's balanced in such a way that it doesn't take down the person who has it, either through death or in many cases through laying them out, quickly enough or often enough that a lot of people can spread it because they have it, but they're still moving around. Hence, a disease becoming a pandemic, right?
Yeah, absolutely. And I do want to just kind of double down on that from the perspective of the virus. That it was obviously not, when I use the word sweet spot, it was not from the perspective of humanity, it was from the perspective of the virus. And that's why we're seeing what we're seeing right now. And these things, have been known to cycle through, after, every 100-ish years or so. And so this is what kind of why, when H5N1 came around, boy, when was that, like 10 years ago?
1918.
And SARS,
102 years ago. Yeah.
No, in the H5N1, not H1N1.
I'm sorry.
1918, right, the 1918 was the H1N1.
Right.
Yeah. So I was talking about the H5N1 was the one, I think that was what they referred to as the avian influenza. And I think that was like maybe in 2010 or so. And again, that was and SARS was 8 years before that. And, you started to hear people refer to that, that these epidemics were going to likely kind of come around. But, going back several steps, am I surprised to be doing this in my own hometown? Frankly, yes.
And why? Why is that a surprise?
because I'm so used to going out. I'm so used to traveling outside of the country. But again, if you really, really pushed me to it, I guess I would have thought that maybe something like this eventually would come around. Now, New Orleans particularly has the highest incidence, at least as we're recording today, Thursday. I don't know what day it is today. I don't even know. I'm not going to even pretend to know. We have the highest incidence of cases, and that's a really good question as to why that's the case.
Right.
It's gonna be epidemiologists that are gonna help us understand that. But I think if I were to take a rough guesstimate on it, is that one, we're a small city, we tend to congregate together pretty well, nightclubs, bars, restaurants, parties. But
Mhm.
really, more than anything else, and this is the thing that's gonna, I'm just kind of just throwing this out there. We did have Mardi Gras a couple weeks ago, and
Mhm.
so could that, we were all literally on top of one another, crowded together, parades. Even though I was trying to do my best to try to keep some social distancing, I was aware of it. And other people were just, the whole idea of coronavirus had not really, kind of had infiltrated people's kind of understanding as it has now. And I wonder if, because we had Mardi Gras just so recently, this is why we're seeing the higher density of cases.
And again, we're talking
And
with
again,
Dr. Mark.
this is
Again,
total
we're talking
theory,
with
sorry.
Doc. I'm sorry?
I said that was
Again,
just a total hip check, theory.
okay, well, that's an interesting one. Again, we're talking with Dr. MarkAlain, Dery, infectious diseases, a doctor, and also founder of WHIV Radio in New Orleans. And by the way, hand to mouth or other transmission from all those beads can't have helped either. I mean, you're passing things from one person to another.
That's
But,
absolutely.
so we're all learning as we go. In terms of New Orleans, a city, as you know, that I love very much. Of course, one of the other striking things about New Orleans, very, very high degree of poverty compared to other communities. And I'm wondering, in the case specifically of New Orleans, about the intersection of poverty and this particular epidemic, and whether you've got any sense of that right now.
Yeah, it's hard to see that. I mean, I work exclusively at clinics that provide services to individuals that are on Medicaid, or have no insurance. So I'm getting a peek at things from the perspective of really the lowest income of individuals, and I haven't really had any sense of one thing or the other with respect to how poverty may be driving this. The only, way that it would is if you have large groups of people, which you do see, and we've talked about this before, where I often say infectious diseases are diseases of the poor, and the reason is because especially when you're looking at respiratory viruses or something like TB, which of course is a bacteria, but when you have large groups of people that live in one setting, a smaller home or an apartment where you have large groups of people where it's hard to be socially distant, and so there you may have individuals that could transmit amongst one another. But I haven't had an opportunity to really kind of take a step back and see, how far poverty is driving this infection. One thing that we are seeing, however, is that this virus does not select out those that are at the bottom of the socioeconomic status or the top. And I say that just because we're seeing more and more recognizable names. Those people who, we have several Congress people in the last day or two. We have had several Hollywood stars state that they were positive. We've seen some sports figures, and then several political leaders around the globe as well. So I think at this point, looking backwards, I think we'd be able to better understand how poverty is driving the disease. But right now, it's hard for me to kind of see it.
I think that makes a lot of sense. Again, Dr. MarkAlain Dery of WHIV and physician in New Orleans. A couple other thoughts. I mean, we can't know, as you said, but a couple other concerns I've had. Now, one of the reasons I'm at high risk myself, and I'm being so careful, besides just getting over a bronchial infection, is I have pretty, serious asthma. And I know there is a connection, for example, between poverty and asthma, or at least that's my understanding. And in terms of I'll just throw a couple ideas out. Love to know what you think. But in terms of the wealthy people or famous people being identified, the basketball players and Tom Hanks and Rita Wilson and so on, the Congress people. I have wondered, as have others, to what extent that's because they can get tested. Gwyneth Paltrow or somebody put their desire to get tested on Instagram, and boom, they got tested, right? So I guess, so I wonder if there's self-selection there, but I think there's an important point you're making, and I think it's related to the point I'm making, which is, and maybe you're making it, or maybe I'm reading into it, which is, look, this should be telling people at all levels of income and social status and everything else that when we say we're all in it together, it's not a metaphor or a cliche. It's a clinical reality that's being displayed right now. And I mean, that's one way I would put it, but I've said enough. So what are your thoughts?
No, I 100% agree with you. And in fact, one of our colleagues, somebody who I admire greatly, and who's Amy Goodman, on her show today, Democracy Now!, was actually just talking about that. I heard her preview the segment. I didn't get a chance to actually listen to it as I was coming here to do the interview with you. She was talking about how one of the well-known basketball teams was able to actually go ahead and hire out a lab, and they came through and tested the entire basketball team. So you're
Right,
100% correct about that, RJ. And that's a great point, and that's one that I wish that I had kind of had come to as well. But there is no question that there are people who are going to be able to jump the line with this, and people are very likely able to, in fact, the whole reason why we have this testing debacle in the first place is that the U.S. decided to privatize these tests instead of going with the test that was originally created in Germany and distributed amongst the WHO, and that's what the rest of the world is using. And one of the big stories that's going to come out of this at some point when we look back at this, COVID-19 time, is going to be what happened in the U.S. Who made the decision to not go with the U.S., to go with what the rest of the world is using? Who made that decision to say, no, we're going to go with a private entity? And when it came go time, that private entity, whoever that corporation or whoever that entity was not able to deliver. And that'll be interesting to see. And I hope that one of our investigative journalist colleagues are going to start hunting that down, because that was a major that was a point right there. Had they gone this direction instead of this direction, we would probably be more ahead of the curve than we are now.
Yeah, I couldn't agree with you more. I'm sorry, I was sort of, you caught me at a moment when I was reaching for breath there. So, which a lot of people are doing. And that gets me to, and some with potentially much graver consequences than I will ever face, or hopefully ever face, out of this whole thing, which gets me to what I might call the arithmetic of human happiness and suffering. It seems to me that whether we're talking about basketball players renting a lab, or whether we're talking about who's responsible for this debacle, well, actually, I'm going to say something a little different. You talked earlier about seeing your patients in their homes as a result of the telehealth. And therefore getting, kind of a broader sense of them, right? Because you can see the home in the background, you can see how they relate to their home and all that. And it gets to a dimension of medical care uh, that I think is overlooked, not by you, but by our discussions of medical care, which is, first of all, you may be seeing them for because they're HIV positive, but that's just one dimension of their humanness, and they're full. All the dimensions of their humanness matter, and all the dimensions of their humanness will affect the course of the one condition you're looking at. Number one. Number two, their humanness involves how they live, their home, which you're getting to get a glimpse of now. It involves their family, it involves their neighborhood. It's like concentric circles broadening out to eventually the whole country, the whole planet. And I know I may be talking blue sky here, but it seems to me like one of the breakdowns in both our clinical system of tracking disease, the diagnostic codes and treatment codes, from those little lists of numbers up to how we budget nationally for healthcare, we are not seeing the forest for the trees. You get what I'm driving at?
I do. Yeah, I certainly do. I mean, what we are seeing is just uh, like you're saying, first of all, being able to kind of tap into people's homes through the phone does provide this incredible context that I've never been able to really. I didn't know what I didn't know. It was an unknown unknown. To quote to quote Rumsfeld, it really truly was an unknown unknown. And now that I'm aware of it, it's now a tool that I definitely want to be using moving forward into the future. But some of the other things that you're bringing up is this notion also of of how our fragmented health system, it was just not ready for this. When you look at the number of tests, I think I heard this morning we're up to 60,000 tests now in the U.S. South Korea tests something like 20,000 people a day. So one of the things, let's just put that right there. When you saw Dr. Fauci the other day talk about the failing of our system and that the fact that our healthcare system is just not set up for something like this, I think and I hope that coming out of this, we will see the need to create more of a unified healthcare system, because right now it is completely fragmented. We just don't have enough people. We don't have enough healthcare workers. We don't have enough individuals. We're running out of supplies, RJ. That's another thing that I'm sure you've probably hearing. We're having to reuse N95 masks. I'm having to reuse our gowns. I read a story of some people at a hospital that are making their own masks right now. So our broken healthcare system, and it's so fragmented because for some reason we just there's this reluctance to unify the system. We obviously know what that reason is. There's more of a concern of profits over people, and that's the real issue there. But we as a country we're just not prepared for this, and I it was with it was with an eye that I thought was its time was coming, was when Norway, I think a couple days ago, issued a statement that they were pulling all of their students out of the U.S. because of that the U.S. Did you read that statement? I think it was that because of the terrible healthcare system, and it made a statement that the U.S. just is going to not be ready for this epidemic, and it was asking their Norwegian students to come back to Norway, where they felt like they were going to be safe. And I think that the rest of the world has looked at the U.S. and has seen that for some time, and maybe never wanted to verbalize it. And it's certainly something as healthcare professionals, and of course, you've been writing about this, obviously, RJ, for years, as I've been following your work, that this virus and this epidemic, this pandemic, if anything, has really kind of ripped the Band-Aid off of this gaping wound that was the U.S. healthcare system, and has shown that we just don't have what it takes to actually sustain an epidemic like this. And so one of the big wake up calls that I see, and I think we may have talked about this the last time, was when I said, hey, life is going to change for a lot of people coming up. And that's what we are seeing now. Life will be different moving forward. Obviously, our lives are going to be lived indoors significantly. So, that's the reason for that is for something called flattening the curve. And maybe I can get to that in a quick second.
Sure.
But one of the big shockers that's going to happen is that we're going to see healthcare workers likely pass. They're going to get sick because we are on the front lines, and I fully expect myself to obviously I'm exposed. I'm testing people, and I'm seeing people face to face, but I'm doing most of it through telemedicine, obviously, to protect the community, to protect myself, and to protect people who are positive from leaving their house. But when we start to see healthcare workers potentially get sick and be in the ICU, I know of two physicians right now that are in the ICU. And of course, the last time we talked about Dr. Li, who was the ophthalmologist in China, in Wuhan, who actually in early January went to the equivalent of Twitter in China called WeChat and put a message out to his medical school friends about this potential virus that he was seeing circulate in his hospital. And of course, within a couple of weeks after he was initially arrested, and then after an outcry, the Chinese officials released him and put him in a coronavirus ward. Unfortunately, he became quite ill and passed from this. And so we're going to see likely politicians. We're going to see celebrities, and beyond that, we're also going to see our loved ones potentially pass. And so I think that moving forward, there's going to be a lot more unfortunate pain, if you will. I certainly don't mean to be an alarmist, but I'm just speaking truthfully here. And as now we are seeing more and more testing coming online, we're going to start seeing a rapid doubling of cases here in the U.S. And I just wanted to make sure that people understood that and were ready for some of that.
Yeah, gloomy prognosis for sure, but as Dr. Fauci says, if you think you're overreacting, you're probably getting it more or less right. I guess in closing, before I let you go, Dr. MarkAlain Dery, it's always appropriate, no matter how many times we hear it over and over, to talk about what people can do to minimize their own risk. So, I think some of our listeners are lower income, some are higher income, and so on. People are in all professions, walks of life, and so on. Any thoughts on that?
Yeah, I mean, so these are kind of like my regular, talking points, if you will. Is hand washing, 20 seconds, soap and water, 60 to 90% with hand sanitizer. I keep this around all the time, and I've got them in my pockets. My mother-in-law was here 2 weeks ago, came to visit with us. She just went straight to the pharmacy, bought a bottle of isopropyl alcohol, and bought a bunch of these. And she just skipped that gel altogether because those are just not able to be found anymore. But and just we've been spraying that on our hands as well. But hand washing, hand sanitizers. Please stop shaking hands with people, elbow bump, or just do a phantom elbow bump with somebody who's standing 6 feet away from you. It's an incredibly good transmission route, is shaking hands and then obviously touching your face. Everybody, if possible, please go get a thermometer. An oral digital thermometer is best, but whatever thermometer at this point that you can find. The reason for this is that if you do end up having a fever, if you feel like you have a fever, your brain is disconnected from your body somewhat, And so your brain will say, I'm burning up, but you put a thermometer in you and you're 98.5. And those are referred to as subjective fevers. What we really would like is an objective, we want an objective temperature. So please go get a thermometer, because when you call a healthcare worker, the first thing they're going to ask is, what is your temperature? Please go make sure you're stocked up on all your medications, and including over-the-counter flu and cold medications. Cough suppressants are very, very important to have on hand, as are fever reducers. There's this potential question of NSAIDs, Motrin, naproxen, these sort of stuff, of potentially causing some harm to people with the COVID virus. That the jury's not out on that, but because of it, and because theoretically these are anti-inflammatories, and inflammation and immunity are the same thing, right? We have different names for them, but they're two sides of the same coin. And so if you're going to be dampening the inflammatory response using NSAIDs, some people feel as though you are likely going to be dampening the immune response as well. So the WHO, I think yesterday or 2 days ago, just put out a paper that is recommending to not use NSAIDs, at least right now. And again, the jury's not out, but I would refer people to do Tylenol. If you have liver problems and you can't take Tylenol, I would then go to NSAIDs to be comfortable. And then lastly, I would say, please check up on the people in your community. You were talking about us going through this as a community. RJ and I 100% agree with you. I think we're going to be living our lives a lot more online and doing a lot more of these video chats. But if you can go out and find the folks that are at risk, that are particularly vulnerable, those that are elderly, those are important community partners that we can look after as well. And if I could just say one more thing, RJ, for us to look at 4 more populations that we really need to be very concerned about, and that is those people who are in the carceral system. We need to be worried about those people who are in immigration camps. We need to be worried about those people who are in homeless communities and shelters. And lastly, we need to be very worried about those people who are in nursing homes. We saw people who are dying in Seattle, and we are seeing people die here in New Orleans in a nursing home here. And I think we had our 4th death last night. I think 2 people from that nursing home died yesterday. And so those are kind of my big ideas of and things to do and things to look out for moving forward.
All right, well, that's extremely, extremely helpful. And speaking of looking out, moving forward, Dr. MarkAlain Dery, Infectious Diseases Director and founder of WHIV-FM in New Orleans, take care of yourself as well. We care.
You too. Thank you guys very much. Thank you guys. And everybody out there, please be safe. Please wash your hands.